My name is Brandon Ayres. I'm a cornea and anterior segment specialist in the greater Philadelphia area. I'm part of the cornea service at Wills Eye Hospital, and my private practice is called Ophthalmic Partners of Pennsylvania. The local Moria rep came to our residency program, donated a set of 4 instruments. It was the needle holder, a tooth forceps with a tire, and 2 tires, a straight and curved tire. And I started using those as a resident, and even as a resident, I recognized that the quality and the thought that went into those instruments was higher than most instrument companies put into their instruments. One of our representatives from Moria would come in and just say, "Hey, how are your instruments doing?" We'd look at them. If anything was a little bit bent or broken, take those instruments away, service them, bring them back good as new. And I think that means a lot. That means that, the company is not only invested in getting their instruments out, but also taking care of their customers. Because when you take care of your customers who are surgeons, you're also taking care of patients. Right? So it shows that they care. Very easy to work with and super high quality company. We're always looking for new devices, and having the kind of the power, the knowledge base, the expertise in instrument design from Moria would be great to see some new instruments, maybe whether it's for endothelial transplants or iris reconstruction, or even just continuing to make cataract surgery more efficient. Moria is one of the best instrument companies out there. And we haven't heard much from them recently. They've kind of fallen in the background. Of course, I've always loved my instruments, but I haven't heard that much from Moria. It'd be nice to see them back at the forefront, making new instruments, new designs, and getting back into the limelight, if you will, in eye care and ophthalmic surgery. In some of the surgeries, I was talking about the quality of the instruments, and these are 2 of my favorites. This is the needle holder. This is a very fine jaw, and this is an instrument that I will hand to my fellows, and I warn them. I'm like, if you drop that, I'm gonna kick you in the shins. This is fantastic for holding needles. I would say up to maybe an 8/0, but beyond that, you'll begin to bend the needle holder. But this super fine jaw allows us to hold a very fine needle. Remember, these needles are almost invisible. Like if you sneeze, it's gone. You're not gonna find it again. So we're talking about nearly microscopic needles with suture thinner than a hair. That combined with the tooth forceps, right? And these engineered round handles are fantastic because not only are you holding an instrument and moving your hand, you're rolling it in your finger. And having a rounded handled instrument allows you to not only kind of use your wrists, and sometimes we're holding these in awkward patterns, but also use your fingers for the action of the instrument. Another instrument that I was very impressed with is the cystotome tip Utrata. This is basically a piece of ophthalmic surgical jewelry. Very sharp cystotome tips. It's all about efficiency. So instead of reaching for a cystotome, which is a bent needle, to start your capsulorhexis and then saying, "Can I have the Utrata?" With this, you simply make your incision, you go into the eye, you both start the capsulorhexis with the cystotome tip, and then make your round rhexis without switching back to another instrument. So combines 2 instruments into one, gives you great control. I've seen some Utratas that have cystotome tips that don't always make a consistent incision. These have been very consistent, but because they're such a precision instrument, you want to make sure you put them back in the holder so they don't get damaged during processing. So these protective cases are fantastic at keeping your precious instruments in good shape for your next case. These Moria instruments have this plastic case, and this is where the instruments kind of live when they're going back to get processed, and they can get sterilized. So really works well. There's a little metal post in all these round-handled instruments, and if we just squeeze this together, put it in this little protective sleeve, the round post fits right in there, and now our instrument, the tip is protected, it's ready to go back for processing. So when it's ready for the next case, it is good as new. Another fantastic instrument is the Gorvoy forceps. This is for doing endothelial keratoplasty. Most ophthalmic surgery, we're reaching down. We're reaching, from our cataract incision down to take out the cataract or touch the iris or touch the retina if you're a vitreoretinal surgeon. But in the world of cornea, we have to reach up. We're trying to reach the corneal endothelium to remove that delicate layers of cells for patients with Fuchs dystrophy or pseudophakic bullous keratopathy. This instrument allows us to take the ease of a forcip, okay, so when we're doing these lamellar keratoplasties or endothelial keratoplasties, we can reach up, actually grab the cell layer, and then remove it almost as easy as we would a capsulorhexis. For corneal transplant surgery, we really focused on the needle holder and their tooth forceps. In fact, we used it for 95% of the surgery, and we used their vacuum trephine, which you can set the depth for, which is very nice. So we no longer have to guess about how deep we're going into the cornea with our trephine. This had a safety stop, so we made sure we were extra safe with our surgery.